Welcome back to LX News. I'm Tabitha Lipkin. Now, before I begin, we do want to warn you, we're talking about drug overdoses. Now, we have had this conversation a couple of times in the past, but this time we are taking a deeper dive into drug overdose deaths among teenagers. Data from the Journal of the American Medical Association shows teens and preteens may have lost about 200,000 years of life to unintentional drug overdoses. Now, that is the number of years of life lost for 10 to 19-year-olds who died between 2015 and 2019. Now, if you go ahead and expand that data out to individuals who were 24 years old, unintentional drug overdose deaths resulted in the loss of 1.25 million years of life. Let's put that into perspective. In 2019, there were over 70,000 drug overdose deaths. That's according to the CDC. 70% of drug overdose deaths that year involved an opioid. And data from the National Center for Drug Abuse Statistics show that between 2016 and 2020, drug use went up 61% among 8th graders. Yeah, I said 8th graders. 50% of teens had misused at least one drug. Now, last week in Bloomfield, Connecticut, police say that a 16-year-old high school student suffered an apparent overdose. Police say that the overdose may have been triggered by marijuana that was laced with fentanyl. And a similar incident happened in Hartford, Connecticut, with a 13-year-old who unfortunately died of a drug overdose last month. Police said 100 bags of fentanyl were found at the teen's home. 2 other 7th graders may have come in contact with the drug, and both of the students were taken to a hospital to be checked out. Now, the superintendent of Hartford Public Schools released a statement saying, quote, "Our school and district crisis intervention team has already been assembled and will continue to help with the needs of students, parents, and school personnel. I recently spoke with Dr. Paul Christo about the new calls for schools to increase training on how to recognize and respond to overdoses, like the warning signs that you see right here on your screen, plus how parents should approach having this very difficult conversation with their child." Dr. Paul Christo is an associate professor at Johns Hopkins Medicine. In addition, he is the author of Aches and Gains, a comprehensive guide to overcoming your pain. I want to start here. I understand that you are a father of 2. So when you hear unintentional drug overdoses led to 200,000 years of lost life for preteens and teens, what comes to mind for you?
Well, horror, basically, and it's 1.25 million for young adults, as a matter of fact, in terms of years of life lost. I think it's tragic, yes, because we're talking about kids that are in my age group, my children's age group, that is, around between the ages of 10 to 25 or 26 years of age. So I just think it's terrible, frankly.
And the study, it saw a rise in drug overdose among young people years before the pandemic. Have you found any similarities or differences between the rise in drug overdoses back then compared to now?
Well, there was a study actually before this that examined adolescents and young adults for about 19 years and discovered something very similar. That is, the overdoses were often unintentional, and there were 2 reasons for those overdoses. That is, one, there were polysubstances that were being used. So that's 1 or 2, basically 2 or more substances that are being used. And what were those substances? An opioid and a stimulant drug, specifically cocaine, that were leading to deaths.
Interesting. I kind of want to know a little bit more about that, because I know that fentanyl is a word that we hear a lot, especially when it comes to drug overdoses. How has that played into the studies that you've seen so far as well?
Well, certainly in the adult population, we're seeing the majority of deaths due to the synthetic drug fentanyl. But recent evidence now suggests that this is occurring in young adults as well, adolescents and young adults, which is especially concerning. Fentanyl is about 80 to 100 times more potent than morphine, so it easily leads to death if ingested, that is, if inhaled, so through the nostrils, or if injected intravenously.
Back in 2016, the American Academy of Pediatrics recommended universal screening for substance use with young patients. What has been the result of those screenings? Were they helpful? Were they harmful?
I think they're helpful, but I don't think that physicians and other healthcare practitioners are doing them to the degree that they need to do them. In fact, that's a prime recommendation now that we're seeing that the huge number of unintentional overdoses in the youth. So I think physicians, other healthcare providers need to establish greater screening methods, more intense screening methods.
Okay.
When they're prescribing, for example, opioids or stimulant drugs or sedative drugs in this population.
For a lot of millennials, we grew up with the DARE program at our schools. It's still around today, and I'm curious, how can schools improve addressing substance misuse?
Well, substance misuse, unfortunately, is quite common in this age group. In Generation Z, experimentation is common. So I think we need to target educational programs to this generation to make sure that they understand the risks that are associated with using these types of substances. Because I feel like I don't really feel like they understand the risks. And this is true too, actually, among adults, especially with respect to fentanyl, but even other drugs like heroin and cocaine.
Right. I think it's because when we were in these programs, it was kind of an abstinence type of approach. Don't touch them, don't do them. There wasn't a lot of education on what they were. So if there was a curious mind, they might be getting themselves into a situation that they don't have any information on, and that could lead down a very bad path. Now, in this kind of setting, I'm curious, hearing this kind of data is very scary. It's scary for me, I'm sure for you as a parent, but other parents who might be watching. How can parents approach having these kinds of conversations with their child about substances and drugs?
Well, I think they need to have very direct conversations with their children. That is, here are the drugs that are being used by probably your peers. These drugs are out there, and here are the risks. And namely, the major risk here is death, and that's what we're seeing to a greater extent. Now, the means of death differs according to the drug, right? With opioids, for example, it stops your breathing. With cocaine, it can lead to a heart attack or a stroke. So I think parents can be more direct and more honest with respect to the effects of these particular drugs.
I appreciate you coming on, explaining a little bit more and sharing your data.
My pleasure. Thanks so much for having me.
And if you at home or someone that you know is facing mental or substance use disorders, you have options. Please call the Substance Abuse and Mental Health Services Administration. The number right there, it's on your screen. We're going to leave it up. It's 1-800-662-4357.